Greetings, well-beings. Welcome back to the channel where I make health information totally relatable. Today, we're clocking in for the 9 a.m. hour at a shift at the Pitt on HBO Max. I've been getting so many requests to cover this because everyone misses that high-stakes ER energy, but is the medicine actually sound? Today, we're going to jump into 2 zebra cases in this episode. This show has a unique ability to talk about specific medical diagnoses, and it's so exciting to watch both as a healthcare provider doctor and as an entertained person. Me, Dr. Sherzad, a real doctor, will break down episode 3 just to see if the Pitt writers did their homework. Let's scrub in.
Stop talking to me! You can't!
Heart doesn't have anything.
Yeah. Wait till after he's sedated. 5 of I'll put them down at 5.
No, you can't give it without knowing his PT.
They're talking about antipsychotic medications, which are used for sedation. The first thing I thought of when I saw this acutely delirious young man was PCP intoxication.
What do you got there? This is a gallon of PCP.
Wow!
Although I don't know how common that drug is used these days, but back in med school, I learned that when patients are overdosed on PCP, they have this like Hulk-like nature. They're aggressive, they're really, really wild. And so I first thought of like PCP intoxication, not gonna lie, but they're talking about antipsychotics to calm him down because he's a danger to himself and others right now. So that is medically sound while people are acting wild like that.
Auto versus motorcycle, altered with normal BP setting 99 on 2 liters.
Skull fracture, tubed in for agonal respirations. BP 60 palp initially started a liter of NS but lost his pulse en route.
That means that the blood pressure is barely palpable, which means it's like when you check blood pressure, you put a cuff around someone's upper arm, inflate the cuff with air, which means you add more pressure. When whoever's listening with their stethoscope hears the first beat and the heart, I really want you to know your blood pressure, or to know at least what blood pressure is, the amount of pressure needed to circulate blood throughout your whole body so that your organs receive blood, and it starts from your heart. So your heart's contracting, and if the pressure in the arteries is too much, your heart is pushing against a narrowed tunnel, so the heart muscle gets bigger because it's pushing against high blood pressure. High blood pressure is 2 numbers, systolic and diastolic, the top number and the bottom number. If you want to be a pro with your vital signs, you must know your heart rate as well. If someone ever asks you like, hey, do you ever check your blood pressure? You would know like, yeah, I kind of run in the 130s. That means the top number. Or I kind of run in the 90s. Like I have a lower blood pressure and my heart rate's usually around 50. It's usually around 70. Those are pro tips for you to know your health.
Joey, check his pupils. Somebody hand me a pair of scissors. Okay, blown pupils fixed and dilated. Oh, gosh.
The pupils are fixed and dilated, which means they're not constricting to light, which they should constrict to light automatically. It's the pupillary reflex, which the cranial nerve 3 is responsible in the brainstem for. So it could mean a sign of brainstem dysfunction or disease, but we'll see. It's just an exam finding.
Asystole. I think we...
Quick and out. So brainstem dysfunction. So asystole, that means he's gone. Asystole is a medical term for flatline, which means there is no activity in the heart. There's no blood pressure. And the fact that the pupils were blown is a pretty bad sign, meaning that there's no brainstem function.
Present. Intubate? Maybe, maybe not.
Mr. Yee. Joy, sternal rub on his chest like this, really hard, please. Mr. Yee.
A sternal rub is when you push, because that's supposed to be a really painful area, like a breastbone. So it's like they don't wake up to that, and it's like, is anything happening? So now they're checking all his reflexes.
Let's not make this worse.
The legs.
Hand scan with 3D reconstruction of the spine.
Hand scan
Is
means
quadriplegic?
completely
So
scan
it's
the
a low
body,
cervical injury.
Why is that, Joy?
like pandemic
C3,
hand
4,
scan.
and 5.
So they're also checking his GCS, which is a Glasgow Coma Scale, which indicates whether you have to intubate someone or not. And intubation basically means like sticking a tube down someone's throat into their windpipe where it inflates air into the lungs, like literally like a balloon. It's called a ventilator, intubation plus ventilation. That's an automatic win to the ICU.
I'm sure you have some questions. I know it's a lot to take in.
It's a tumor. It's a brain tumor.
Well, it's a mass.
So she said, well, it's a mass. And that's a really important distinction because a mass isn't always a tumor. A mass could be a cyst, an infection. It could be generalized inflammation. It could be scar tissue. Yes, it also could be a tumor. But a mass means a description of something. It's a descriptive term not a definitive or diagnostic term. And if it's a tumor, it could be a benign tumor or a malignant tumor. There is a difference.
4 centimeters in the frontal lobe.
Is it cancer?
We can't say for sure right now. Infection,
Exactly.
inflammation, a benign cyst.
Is it what made me fall?
Yeah, most likely.
Yeah, possibly.
He also had a personality change, right?
We'd
so
like
it's
to
most
keep
likely
you
in the
here and
frontal
treat with
lobe.
dexamethasone, which is a steroid to take down the swelling.
Steroids are used in medicine to reduce inflammation, whether the inflammation's in the airways or in the brain. It's to reduce swelling.
I know exactly what it is.
You're going to cut open my head.
He's so scared. I mean, I would be too. It's really scary.
P95/67.
Seemed a little on the low side. It is.
Well, that's actually okay if he has that pressure regularly, like I was saying before, but he was dizzy and fainted, so maybe it'll be low for him.
No, sir. My blood pressure is always high.
Okay, and if his blood pressure is always high and it drastically gets lower all of a sudden, that could be another reason for someone fainting or getting dizzy because your body's used to a certain pressure.
No talking while we do the EKG.
That's funny. The nurse is like, everybody stop talking because, yeah, the EKG or the electrocardiogram with the stickers on the chest, it creates an actual pencil or a pen lining tracing. And so if someone's talking, this reverberation or the vibration on the skin changes the tracing, and then it's harder to read the EKG.
You want to help? Quit playing family pharmacist.
Who? Amen. Everybody, please stop playing family pharmacist. And please stop paying self-doctor. Public service announcement.
Meds is how we've always done it.
That sharing meds which haven't been prescribed to you is actually a real big no-no.
So it sounds a little bit like a term we call polypharmacy. Polypharmacy means when people are taking too many medications at the same time, or they're mixing medications, or they don't know what they're taking. And they sound like they pool all the medications together and just like pick one. Today, I had a patient in the office that actually was taking a medication totally the wrong way. He was taking the medicine for diabetes every 30 minutes instead of 30 minutes before a meal twice a day. That caused him to have low blood sugar, and he was feeling dizzy and tired. And he said his daughter found him asleep. And I educated him some more that people can die of hypoglycemia from glipizide overdose or taking too much diabetes medication. And thank God he was okay. But a lot of that stuff happens. So
Scanner can take him now.
I'll check the results from upstairs.
Why is he so altered?
Maybe a small intracranial hemorrhage.
I just think it's so funny in medical terms, we use the word altered instead of confused. But altered mental status is the way we just medically describe confusion. Or he's not confused though, he's out. Like it's a little bit of a comatose state. He's not responding. And the attending told her, Dr. Hashimi told her, it could be a hemorrhage, it could be a mass, it could be a concussion. It's hard to tell right now. And he used the word donut of truth.
All will be revealed by the donut of truth.
But it makes sense because the CT scan is shaped like a donut, and that's how I describe it to people.
Baby, what's going on, huh?
My chin's broken, my chin got cut.
Oh, no.
I was saying, Mr. Connors, the laceration's pretty minor.
On the stairs?
It was an accident. Perhaps we can step out.
Accident that wouldn't have happened if you weren't running up the stairs. Do
We
you
weren't
understand what I'm
running
saying?
up the
This is the last
stairs.
thing that I need.
It was an accident. And before you get all high and mighty, I've got questions of my own.
Like what?
This is so awkward. They're like arguing with each other right on top of the child. I'm so protective over kids. Like, I don't have any kids of my own, but I don't know. It just looks like a really hard job. But also, like, try not to argue while she's sick on top of her while she's right in the middle of you two.
Connors, I'm sorry. I meant to be here when you arrived. I'm Dylan Easton. I'm social services.
We have insurance, thank you.
Perhaps we can...
We noticed some bruising on Kylie's body, some old, some new, on her back and legs.
What? I'm sorry, are you fucking kidding me? Where are you going with this? Are you saying that I hurt my daughter?
Mr. Connors, no.
Oh, no.
Who the fuck?
Yeah, that's what I'm asking. Hey, big man, take one more fucking step.
Hey,
I
that's
dare you.
enough. You need to calm down.
Kylie's platelets are only 9,000.
What does that mean?
It's not what we thought. It's probably ITP.
What the hell is ITP?
So only Dana can break up a really good fight. First of all, can we just talk about that? Like, platelets being 9,000 is pretty diagnostic in a patient with multiple bruising of ITP, immune thrombocytopenic purpura. It's an autoimmune condition. And Thrombocytopenia means low platelets. Purpura means bruising. ITP is not rare, but it's not common either. Like, I've taken care of patients with ITP. They know they have ITP. They usually take prednisone. Bone marrow is in the hollow part of the long bones. And in the bone marrow, it's responsible for making 3 types of cells: the white cells, the red cells, and the platelets. That all is checked by a very basic test that almost every doctor runs like a gajillion times in their career, and every patient has checked on them, called a complete blood count, CBC. Her platelets are low, not her white count and not her hemoglobin. ITP doesn't matter unless you're actually bleeding, unless the number's like really, really low. It's not that it doesn't matter, but I'm trying to say that there's no treatment indicated. That's when it could be catastrophic, when they're bleeding and their platelets are low, because platelets are responsible for plugging up any bruising. They're responsible for making clots and fibrin, and platelets are super, super important for the body. If they're dangerously low or if the patient's bleeding, that's when treatment is needed immediately.
You mentioned that you dropped the samovar when you heard firecracker.
I was on my way inside, October 27, 2018, when the shooting started. When kids have their fireworks and firecrackers,
There is no clock on how long it takes.
It's really powerful. She's talking about the 2018 Pittsburgh synagogue shooting, where it was considered the deadliest anti-Semitic attack in the United States history. And it was devastating. 11 people were killed. PTSD is a real diagnosis and it has real triggers. She dropped the samovar, hot water, when she heard firecrackers because it simulated the shooting. And why I gasped is because this is a really powerful scene. The nurse that's taking care of her is clearly Muslim. She's clearly Jewish, and they're bonding and sharing this intense moment of human presence. And I think that was wildly brave and appropriate of the Pitt. Get a little spiritual, but it's form. We're stuck in this body, which is called form. If we could all be a little more formless and more being focused, like aligned with our nature and present with each other, we would all get along so much better.
No bleeding inside the skull, C-spine, no fracture C.
Can have spinal injuries without radiologic abnormalities.
Sometimes it doesn't show up on CT, only on MRI.
It's true. So basically CTs are best at detecting like bony or like really bad soft tissue abnormalities, but MRIs are best for the spinal cord. Now you're going to say, well, why didn't they just jump to an MRI first? The CT takes 15 minutes to do, and it's quick, it's easy, it's done, you get an instant. And if you have a bleed, you need to know about that like way quicker. An MRI of the whole spine and the whole body would take maybe an hour, maybe longer. So that's why they did the CT first.
Dr. Mohan, are you sure? Okay. Critical potassium level 1.2.
1.2? That's really low.
She may be looking at
hypokalemic periodic paralysis.
What is that?
It's a rare condition where potassium gets shifted into the cells, causing profound weakness.
Okay, let's go for a twist. This is the second zebra diagnosis. The first was the ITP with the young girl where we all thought the father was beating her. Second is this zebra diagnosis, which is hypokalemic low potassium periodic paralysis. Turns out Mark isn't paralyzed from the crash. He just needs potassium supplementation. Low potassium is rare, and fascinating. But this is classic medical mystery bait for like a house in the episode or the Pitt.
See, bottom 3 fingers make an E for jaw lift. 1 breath every 5 seconds. Come here. All right.
About 2 minutes since defibrillation.
He said like make a C under this reminds me of my anesthesia rotation, but you're supposed to put your 3 fingers under the jaw right here while the patient's like lying in front of you. And that lifts the airway.
Normal sinus.
Carotid, strong carotid. Okay, let's try for BP.
Normal sinus means it's a normal sinus rhythm. The heartbeat is regular.
Oh, shit.
Oh, wow.
Seatbelts. Oh, shit. Hang 2 units of Odeg on the rapid diffuser. Somebody call Garcia.
Okay, looks like she has a splenic rupture or injury because she has all this bleeding towards the spleen. The right side has the liver.
Okay, Leo, can you zoom in and please hold it a little steadier? Ezetimibe. Those are all high cholesterol medications.
Oh, this is the family.
You're the right? Okay, yeah, well, this makes a lot of sense now. Propranolol is a high blood pressure medication.
It's also used for stage fright. So a lot of like people who do public speaking take a propranolol, or sometimes if you get married and you're not going to be nervous, you take a propranolol to help you relax a little bit.
Good vitals in the field, no distress. She refused to sign in.
You should have convinced her.
20/20 hindsight, she was stable.
Until she wasn't.
That is a lot of pressure to put on someone that you should have convinced her to get checked in. Like, she didn't want to. Like, I don't know how to handle that type of conversation because people get to choose what they want and don't want.
Blood sugar?
Down from 521 to 436.
Woo,
That's good,
a pretty high sugar.
Moving in the right direction. Were you able to get a hold of your mom?
Anytime the sugar is above 500, it reads as critical, and it means that someone's massively dehydrated because of the osmotic effect of glucose. So the first thing you got to do if you ever have super high sugars, if you're diabetic and have super high sugars, is drink tons of water. Drinking tons of water will help fix the dehydration associated with hyperglycemia. That's why they're giving a lot of IV fluids right now.
I'm a rabbit, grabbing all carrots before the farmer gets me.
Keep going.
Cute.
This is a cat's extractor with a tiny balloon at the end.
Super
what we're gonna
cool.
do is we're gonna slip it past the bead, inflate the balloon, try to pull out the bead.
Is it painful? No, he's numbed up.
Oh.
Voila, one red bead.
It looks like a video game.
Yeah? And it turns out there's no handbook for fatherhood, so I will take all the wisdom.
Oh my
I
gosh,
can't.
the world could use a lot more of healthy
Blue bead
masculinity. I really
out.
appreciate these three men talking about this topic. Yes, yes, and yes. So that was my take on The Pitt, whether it's a gritty medical drama or real life. Knowing the difference between entertainment and actual medicine is super huge. But I will tell you that while watching these and reacting, I learn a lot myself, and I've been practicing doctor. And if you enjoyed my doctor reaction breakdown, hit that subscribe button so we can keep fighting medical misinformation together and learn more about our health to make it more relatable. And as always, own your health, own your future.